Regular vigorous exercise is, without a doubt, one of the most effective ways to prevent a host of negative health conditions: obesity, heart disease, diabetes, high blood pressure, depression, stroke, and even cancer. Yet 80% of Americans simply don't do it. I say simply, but it really isn't that simple at all. Most folks have great intentions, but as we learned in video 15, the best of intentions can easily be disabled by a rather ordinary set of IKTs, intention-killing thoughts. The problem is that our pesky limbic system does a great job of keeping the average human from expending extra energy for no good reason, which is really what exercise seems like to the brain, when it isn't for the express purpose of catching food or getting away from danger. I would go as far as to say that the non-exerciser's mindset is rather innate and might just be the factory setting for all humans. Thankfully, however, it's not a hardwired setting. It's a setting that can be changed. But as most people who have successfully done it know, it isn't the easiest thing in the world to do. Fortunately, there are some powerful strategies to get the system recalibrated. But before I dive headlong into the overwriting of the human hard drive, we must know a few things about the brain itself. First, let's take a peek at the two opposing systems in the brain, the limbic system and the cerebral system. This slide shows a sketch of these two systems, the limbic system in color and the cerebral system in beige. The limbic system is nestled deep in the middle of the brain and is completely surrounded by the cerebral system. The chief job of the limbic system is to control and dole out the hormones necessary to either spend or conserve energy in the seeking of pleasure or avoidance of pain, the two most necessary tasks for survival. The job of the cerebral system is pretty much just about everything else the brain does, including overriding the limbic system when necessary.